I don't want you to be only a doctor, but I also want you to be a man.
Nursing Education for Community Health Equity in Khon Kaen, Thailand. One of the major public health problems in Thailand is the shortage of public health workforce, especially professional or registered nurses, whose shortage has been persistent essentially in rural areas. The production and development of nurses specifically for rural communities is a way to resolve such a problem. Nam Pong Hospital, a community hospital in Khon Kaen province, has adopted this approach on a pilot scale since 2002 by selecting high school graduates who are interested to study nursing in the program Nurses of Community, for Community, and by Community. Dr. Vichai Asawapak, director of Nam Pong Hospital, said that, "We generally look for students' attitudes rather than intelligence, as our belief is that a nurse must be a good person. However, intelligence and skills can be gained through training. We select some science math high school students who are interested in joining the project to work as volunteers at the hospital and in their community on weekend." A community nurse is responsible for providing health care for community residents in and outside the hospital in all dimensions, including medical treatment, health promotion, disease prevention, and rehabilitation. Health promotion, disease prevention, and rehabilitation are the major roles of community nurses who have been nurtured and instructed to work in collaboration with all other sectors in the community to support and create joint community health activities in a systematic manner. The capacity building for community nurses here is accomplished through learning by doing together with their mentors, who have had extensive experience in this field. Sitliporn Leung Udom, professional nurse, Nam Pong Hospital, said that, "What a community nurse must learn is good relationships with the community and how to work with community leaders and village health volunteers. They have to allocate time for community-based activities on a regular basis and be capable of rendering health care for local residents." One of the key elements in strengthening the community nursing system is the process for selecting a person with the intention to further his or her study, and upon completion, he or she will come back to work as a community nurse. The process has to be jointly undertaken by all concerned. Winai Lason, Municipal Clerk, Sa'at Sub-District, Nam Pong, said that, "We are willing to provide a scholarship for our school children to further study, especially those who are interested to study nursing, and upon completion, come back to work for the community. We expect to have a community nurse who can manage healthcare activities for the community." Kanokwan Kaoreungsi, nurse, Nam Pong Hospital, said that, "Having studied with a scholarship from the Sub-District Administrative Organization, I am proud to have come back to serve the community and see villagers' smiles after helping them. Initially, I had a mentor who gave advice on how to work properly. Now I am more knowledgeable and confident in doing my duties." Kwanrudi Lau Sa'at, nurse, Nam Pong Hospital, said that, "We are always aware that the community has trusted and financially supported us to further study and come back to serve the community. We have to reciprocate to the best of our capacity with active learning and self-development through obstacles so that we are accepted as a real community nurse." That means we have to get into and work with the community. Good seeds and good soil make the plants grow fast. Upon passing the selection process, the students get into the nursing education system as community-supported nursing students. At the Boromratchonani College of Nursing at Khon Kaen, emphasis is placed on the creation and development of nurses through the instruction or nurturing process to produce community nurses with the understanding of public interest, systematic problem-solving skills, using the learning activities designed to really facilitate learning and practice. Dr. Jiraporn Warawong, Director of Khon Kaen Boromratchonani College of Nursing, said that nurses are born to care for other people. We have to know how to give away. Our emphasis is to respect and value humanity as well as public spirit. In the nursing profession, we give importance to the nurturing of nursing students in this respect, as we believe that whenever we see the value of humanity, we will see self-worthiness as well as others' values, and then we will take care of others with compassion. The Learning for Change approach is used, focusing on the principles of humanized care and treating the patients as if they were family members. Sirani Sihapak, teacher, Khon Kaen Boromratchonani College of Nursing, said that community nursing is a difficult task and most nurses are not familiar with it. Therefore, we have to reorient nursing students' attitudes, training them to be knowledgeable and skillful in working with the community. Issues related to community have to be integrated into the nursing curriculum for the students to learn and practice as much as possible. The process of creating a nurse is to use the community-based approach. The more we have community-based practice in the curriculum, the more useful it will be. In addition to attending regular classroom sessions, nursing students have to participate in community-based health promotion activities in various forms. Ruchirada Tongpu, student, Khon Kaen Boromratchonani College of Nursing, said that it is my original intention to be a nurse. I used to be a volunteer working on community health, and with the community's trust and support, I've got a scholarship to study nursing. I've been studying attentively so that I will be able to bring back the knowledge to serve the community. Nisakon Sudpa, student, Khon Kaen Boromratchonani College of Nursing, said that we have learned how to work with the community in regular class and from extracurricular activities, which have helped us to consistently learn to carry out such tasks. Working in the community, we primarily focus on health promotion and disease prevention, responding to the health problems jointly identified with local residents. We are happy to see the people participating and benefiting from such activities. Good seeds, good soil, and good nurturing are essential factors for growth. It has been found that many illnesses are caused by or related to poverty, negative attitudes, and underprivilegedness. Dr. Thantip and Dr. Apisit Thamrong Warangkoon, the pioneers of the health team at Ubonrat Hospital, have encouraged the villagers to turn to livelihood development through self-reliance. The focus is on creating well-being through health promotion and environmentally friendly agriculture. Today, the poor communities have been developed and become self-reliant villages in a concrete manner. Dr. Apisit Thamrong Warangkoon, Director of Ubonrat Hospital, said that we are working according to His Majesty the King's sufficiency economy philosophy, which is applicable to all aspects of life, including occupation, health, and happiness. The philosophy emphasizes knowledge and morality, which everybody in any occupation has to bear in mind, as the basis for moving forward any program. We have proved that in carrying out health activities, the building health leads fixing health approach is really workable. So, we do support the production of community nurses program so that it is financially sustainable, and the community nurses, as communities' children, will be the nurses of the communities. Dr. Thantip Thamrong Warangkoon, Secretary General of the Foundation for Sustainable Community Development for Quality of Life, said that, in my opinion, the sustainability of the community nurses production program is dependent on the concept derived by community, for community, and of community, and multi-sectoral participation in the community. This is the dream, well-being system that can be realistic. This is the product of those who have passed through the community-based learning process of the health team at Ubonrat Hospital. After regular office hours at the hospital, their evening duties include working together with village health volunteers in the community. Health promotion for the people needs to take into account the community's context and needs. This is an example of health promotion activities with community participation aimed primarily at resolving people's livelihood problems. Nipa Thaiso, professional nurse, Ubonrat Hospital, said that, as we are based in a community hospital to work on community health promotion, we need to get into the community to work and learn with community members, especially in identifying problems and finding ways to resolve such problems. Local villagers will be healthy when they have good ways of life. We all volunteer to work in the community with 7 missions, namely being helpful to the people in the community, health promotion, disease prevention and control, care for the elderly, care for the underprivileged, care for chronic illnesses, and use of sufficiency economy philosophy. Changes in the community's thinking process and practices have yielded the sustainable results as seen today. Farmers, Ubonrat District, Khon Kaen, said that, we are proud to have attended a training course on sufficiency economy philosophy as invited by the community nurse. Having applied the philosophy, we have had a really sufficient livelihood. We are now healthy and cheerfully happy with our paddy field, and we are also happy to see our vegetables and plants growing up. Being part of the community is the success in establishing community nurses, who are community's children equipped with the knowledge and skills required for working in accordance with the community's context and in response to the people's health needs in an equitable manner.